All right, we are here with Dr. Joel Fuhrman. So happy to talk to you once again. We had a fabulous event, the Never Diet Again weekend in Boca Raton. And so I told your story. I also told the story of your foundation. And so we were able to collectively raise money for the foundation, a little bit over $3,000. So I wanted to publicly present that to you and also have you say a few words to my Never Diet Again community.
Well, thanks so much, Dr. King, for all your work on my behalf and on behalf of the foundation. And thank you to all the people that joined your community to help us. And we're very excited about what's going on. The fact that you're involved and actually physicians from all around the country are coming on board and really using lifestyle medicine as the cornerstone of their practice. And for this to be made to really infiltrate and change the face of healthcare in America, to wipe out heart disease, to wipe out strokes, to wipe out dementia, to really finally win the war on cancer, we have to recognize that we're not going to find a magic pill that's going to wipe out all lung cancer, enable people to smoke 3 packs of cigarettes a day, and we're not going to have a magic pill that's going to wipe out breast cancer so people can eat their processed carbohydrates and junk food. In other words, modern nutritional science has made such tremendous advances, and we have the means now to wipe out breast cancer. We have to put into action. We have to prove the results that we're getting right now, and that's why the Nutritional Research Foundation and doing the work we're doing is going to put these studies on the forefront of the scientific community, and it's really going to save millions of lives.
Wonderful. And that's what I love about the foundation's work is that what I love about your work is that everything that you do is research-based. So it's not just, you're not just dreaming up some hypothesis and writing a book about it. Everything is research-based. And the thing I love about the foundation is that it's research funded by the community, funded by the people that it's actually going to help, not just to go into another pill or another drug. So we're going to put this money towards one specific research study, the Nutritarian Women's Health Study. So tell us a little bit about that particular study.
Right. Super exciting. The Nutritional Research Foundation signed an agreement to contract with Northern Arizona University in Flagstaff, Arizona. We have set up there a Nutritarian research office to spearhead with physicians, PhDs, nurse practitioners, with scientists to run the project under the direction of Dr. Sutliff in Arizona. We've already recruited 2,000 women. Our aim is to recruit at least 5,000 to 10,000 women. And we're taking both women who are healthy now, those who have early stage cancers and those who have a diagnosis of cancer, and we're going to follow them over 10 years using the protocols, the nutritional portfolio, diet style, that both to prevent cancer and can reverse early stage cancer that we're finding in our clinical application. But now we want to prove it large scale to utilize these protocols to show that we can prevent and even treat early stage breast cancer effectively with nutrition. And this only could, this study couldn't be funded by a drug company, couldn't be funded by the National Institute of Health. It has to be public funded, and a lot of the women who are joining onto this project, agreeing to follow this anti-cancer protocol, are themselves going to be some of the contributors who are going to fund this major project over the next 10 years. So thank you for your work in making this project come to a reality.
Well, fantastic. I'm excited. I'm excited to hear more about it and follow along. What are some of the other research that the foundation is involved with?
Well, we have a study that will shortly launch in Boston with a major Harvard-affiliated hospital there. That's going to be a double controlled clinical trial for the reversal of diabetes, cardiovascular disease, and metabolic syndrome with a control group that people are randomized to this new Nutritarian intervention compared to a DASH diet. So I'm very, very excited about that too, and that's a smaller project, like a 1-year project. It's very expensive, but it's a 1-year project, whereas the Nutritarian Women's Health Study is going to give us an ongoing project that are going to follow women through their lives, showing the better health they achieve by taking care of their health better.
All right. Well, fantastic. I really appreciate it. I know you're busy. I've seen all your TV appearances lately and everything like that, so I know that you're very busy. I really appreciate you taking the time out to speak with me and my community, and I'll be seeing you and talking to you soon.
Thank you. And people should go to nutritionalresearch.org, because in the next month, we're going to start to be recruiting more people who want to join the study, not just as contributors to having the study happen, but people may want to be part of the study. And they might want to join as a participant, which means they will have their blood tracked every 2 years. They'd have their diet tracked and have their health issues tracked. So they'd be donating, giving their personal information to the study to track the effect of women who are following this portfolio of the anti-cancer diet and supplemental regimen that's designed to fight cancer.
What's the criteria for someone, if someone wants to join the study, what's the criteria?
Well, they have to be older than 18 years old, and they have to be willing to have their blood checked every 2 years, and they have to be willing to, they're willing to have liquid biopsies, I mean blood to check to see if we can detect cancer in the very early stages. So we're finding out that for women over the age of 50, about 60% of people already have breast cancer in this country. It's just not diagnosed by mammograms till 10 or 15 years later. So they're going to know more about themselves, maybe too much about themselves. And we're going to do these extensive high-tech tests and evaluation of them, monitor everything they're eating and seeing their compliance with the program. And they have to fill out questionnaires and be willing to give their blood and on a long-term basis, and to agree to stick with this very high nutrient, super healthy eating program through the rest of their life.
Oh, okay. Beautiful. Beautiful. And will there be different categories as far as anyone that already has either the gene, the cancer marker for breast cancer, or already diagnosed with breast cancer, hormone receptive, not hormonal, receptor positive? Are there going to be different categories?
That's right. We're not only recruiting in the general community like with you, but we're recruiting with your assistance. We're also recruiting through the offices of oncologists. So cancer specialists are referring their patients, and we have a category, for example, of DCIS, because we expect those early stage cancers, doctors have nothing to offer people except methodology that's too aggressive. They don't need that. They probably need nutritional intervention. We want to prove that's reversible. So yes, like you're saying, is that there won't just be one scientific paper published from this data set. We could publish perhaps 100 papers based on various conditions, and so there may be 100 papers published in the next 5 years alone from this collection. So we're saying we start this collection like the Adventist Health Study has scores of papers published from that collection of data. The Nurses Health Study has 100 papers published from that collection of data. The Physicians Health Study, the Iowa Women's Health Study, so this Nutritarian Women's Health Study collects the data, very high-tech investigative data, and then we publish studies on all those things you're talking about.
Okay, beautiful. All right. Well, thanks again. I really appreciate it. And I'm excited. We're going to stay tuned and look forward to the updates.
Thank you.
All right.
Bye-bye.